In this video presented by Oversight, we are going to review Obsessive Compulsive Personality Disorder. I'm Dr. Gerald Richardson, and let's begin with the objectives. We will first cover the diagnostic criteria, then discuss some of the common features. We will then compare the two disorders, Obsessive Compulsive Personality Disorder and Obsessive Compulsive Disorder. Then we will discuss the prevalence, development, and course, and conclude with our current understanding regarding treatment. So to begin, the DSM, or Diagnostic and Statistical Manual of Mental Disorders, provides the following diagnostic criteria for obsessive compulsive personality disorder: a pervasive pattern of preoccupation with orderliness, perfectionism, and mental and interpersonal control at the expense of flexibility, openness, and efficiency, beginning by early adulthood and present in a variety of contexts, as indicated by 4 or more of the following. 1. Is preoccupied with details, rules, lists, order, organization, or schedules to the extent that the major point of the activity is lost. 2. Shows perfectionism that interferes with task completion. For example, is unable to complete a project because his or her own overly strict standards are not met. 3. Is excessively devoted to work and productivity to the exclusion of leisure activities and friendships, not accounted for by obvious economic necessity. 4. Is overconscientious, scrupulous, and inflexible about matters of morality, ethics, or values, not accounted for by cultural or religious identification. 5. Is unable to discard worn-out or worthless objects even when they have no sentimental value. 6. Is reluctant to delegate tasks or work with others unless they submit to exactly his or her way of doing things. 7. Adopts a miserly spending style toward both self and others. Money is viewed as something to be hoarded for future catastrophes. 8. Shows rigidity and stubbornness. So now that we have our definition, let's discuss some of the common features. These individuals are frequently described as perfectionists, but at the expense of efficiency and/or flexibility. They tend to be rigid and stubborn. So for example, if they're in a group setting, they may insist that things are completed their way. They may view tasks as having one and only one correct way to be done. They have self-imposed high standards of performance. They seek control via adherence to rules, minor details, and schedules or to-do lists. Their orderliness frequently causes delays and inconveniences for other parties involved. So they may focus so much on perfect completion of each part of a task that the project is never completed or not completed by the deadline. And as a result, they may also have poor time management. This is evident by not completing tasks on time, as well as constantly feeling as though they don't have enough time to go to social events, vacation, or other leisure activities. And when they do take time off, they are frequently consumed by feelings of distress, thinking that they are wasting time and should be working on something. They may have repeated and excessive cleaning or organizing, and their hobbies and other enjoyable tasks or recreational activities are also viewed as something that requires perfect performance. These individuals may be inflexible about set rules, morals, ethics, or values, and there is no rule bending for these individuals, even for unforeseen circumstances. Individuals with obsessive compulsive personality disorder are highly self-critical about their own performance and mistakes. And sometimes they're referred to as pack rats by hoarding useless items. They may also view money as something to hoard and may subsequently be stingy, living a life far below what they could afford. Individuals with obsessive compulsive personality disorder tend to have difficulty appreciating the views of others. And decision making is often time consuming and can be stressful for the individual. They may be unable to decide what is the best way to approach a task to the point where they actually never begin it. They may be preoccupied with intelligence and logic, and they may have less appreciation for emotions and feelings. And as a result, relationships may have a formal and serious quality, and they may rarely give compliments to the other individual in the relationship. Many features of OCPD, Obsessive Compulsive Personality Disorder, overlap with Type A personality characteristics, not to be confused with Cluster A personality disorders. Individuals with Type A personality characteristics are said to be competitive or have some sense of time urgency. And an important consideration is that these features may also be present in individuals with increased risk of myocardial infarction or heart attack. So now let's review the difference between OCPD, Obsessive Compulsive Personality Disorder, and OCD, Obsessive Compulsive Disorder. Both disorders may have rigid and ritual-like behaviors. But compared to the symptoms that we just described for OCPD, symptoms of OCD involve intrusive thoughts and often feeling the need to perform a specific action, routine, or ritual. In OCD, the obsessions are persistent and unwanted, generating high levels of anxiety and unease. Some of the common obsessions in OCD include contamination, symmetry, religion, and some of the common compulsions in OCD are hand washing, cleaning, counting, checking locks. These obsessions and compulsions, which are characteristic of OCD, are not as frequently seen in OCPD, the personality disorder. Also, in OCPD, the personality disorder, individuals are what we call egosyntonic. The symptoms are perceived as rational and usually wanted by the individual. The idea of egosyntonic is what tends to make a personality disorder a personality disorder. The individual agrees with their behaviors, and that's what makes it part of their personality. An example is that the individual may view cleaning and order as a means of attaining perfection. Whereas in OCD, these individuals are ego-dystonic. They have unwanted and involuntary symptoms. For example, they may view cleaning as causing significant distress and is unwanted, and this may cause marked impairment in the quality of their lives. So both of these diagnoses are described in the DSM, and they have very similar names. But the main way that you can differentiate obsessive compulsive personality disorder from obsessive compulsive disorder is to look for obsessions and compulsions, which are more prominent in OCD. And then you can also consider whether the individual considers their symptoms as being wanted or not wanted, the idea of egosyntonic or ego-dystonic. Now similarly, OCPD and work addiction may share some common features, as both may have a characteristic obsession with work. The obsessive working in OCPD is egosyntonic, but in work addiction, it is ego-dystonic. And now returning back to OCPD and OCD, these diagnoses are not mutually exclusive, meaning an individual may have both. Having OCD puts an individual at greater risk for having OCPD. However, most individuals with OCD will not meet criteria for the personality disorder. So now let's move on to discuss the prevalence, development, and course. As is with most personality disorders, the exact cause of obsessive compulsive personality disorder is unknown. Genetics and environment likely play a large role. There are links with attachment theory, and some hypothesize that OCPD results when individuals fail to develop a secure attachment style, possibly by overbearing or neglecting parents. Individuals with anxiety disorders, especially generalized anxiety disorder and social anxiety disorder, or specific phobias, and OCD, are at increased risk for having OCPD. OCPD is considered one of the most prevalent personality disorders, and it's estimated to be up to 7.9%. And some studies suggest that it is the most common personality disorder in the United States. And the prevalence is higher in males, almost 2 times more common in males than females. So now let's review some of the subtypes. These are not described in the DSM, but Theodore Millen did describe a few subtypes that you may encounter. First is conscientious compulsive, which includes dependent features. Individuals view themselves as helpful, cooperative, and compromising, and they may downplay their achievements and abilities. Next is puritanical compulsive, which includes paranoid and compulsive features. These individuals have strong impulses, a focus on religion, and may be cold and detached. Then there is bureaucratic compulsive, which includes narcissistic features. They have a focus on tradition, values, and bureaucracy. They cherish organizations with hierarchy and view work and productivity as either done or not done. Then there is parsimonious compulsive, which includes schizoid features. And these individuals have hoarding, and they may be possessive, and they're suspicious of others. And finally, there is bedeviled compulsive, which includes negativistic features. These individuals may procrastinate or have self-defeating behavior, an unstable identity, or be indecisive. And so our final point will be how to treat obsessive compulsive personality disorder. As is with most personality disorders, psychotherapy is the mainstay of treatment. Cognitive therapy, or cognitive behavioral therapy, is typically used. The goal is to reduce levels of anxiety and depression. There are no first-line medications for OCPD. For co-occurring depression, anxiety, etc., medications may have some benefit. Now, just as OCPD and OCD have different defining characteristics, the treatment for the two are also very different. And there will be videos provided by Oversight.com that describe obsessive compulsive disorder. So if you're interested, be sure to check that out. And with that, this concludes our review of obsessive compulsive personality disorder. Thank you for watching.